Hi, everyone. Hello, hello, and welcome to another episode of Ask Deidre, or should I say, Ask a Nurse Practitioner, NP Deidre. Today, we're going to be talking about a very important topic that we hear all the time, but does anyone really tell you how? Curious? Detoxification. You see it everywhere. You see your friends on social media. Oh, I'm doing a detox. I'm doing a liver detox. I'm doing a kidney detox. I'm doing a COVID detox, whatever it might be. And with that last one, I'll probably get completely censored by YouTube. But needless to say, we have Nurse Practitioner Deidre, who is going to break everything down for us. Nurse Practitioner Deidre practices out of Columbus, Ohio, and we thank you so much, Nurse Practitioner Deidre, for being here and donating your time. Make sure you like this video and you subscribe to our channels. Her channel is youtube.com/at NPDeidre, Deidre. Make sure you subscribe. You can also subscribe to our channel with the Global PAD Association. It's our 501(c)(3 is The Way to My Heart. So it's youtube.com/at The Way to My Heart. Both so easy to remember, but don't forget to do it. It's so important to us. And with that being said, welcome, Nurse Practitioner Deidre. Thank you so much. In our New Year's special that we did 1 week ago, which is available on both of our YouTube channels in case you missed it, on how to make your New Year's resolution stick, you mentioned that your New Year's resolution was to do a detox. To me, it's a little bit of cheatery because you can finish a detox very quickly. And what do you do the rest of the year? But with that discussion, everyone wanted to learn more about the process of doing a detox, how to choose it. So, first off, what is a detox?
So it's basically, in a nutshell, it's your body's natural process to eliminating toxins, waste products, harmful substances. So we think of our liver as our master detoxifier. So the liver, your kidneys, your lungs, and your skin kind of work together to cleanse the body and keep it in homeostasis, or a balance that it needs. And so detoxification is that natural process of doing that. There's several phases to detoxification that I wanted to let people kind of understand. Phase one is really where kind of the enzymes and these metabolites, for example, break down viral byproducts and kind of eliminate them. And then phase two is your conjugation, where the liver attaches the molecules to make the metabolites more water soluble so that you can phase three excrete them. And that's through, you excrete through your sweat, through stools, through urine. So it's really kind of important though, that you get efficient detoxification, because we don't want to have a toxic accumulation. Some of the benefits health-wise would be to reduce inflammation, support your immune function, and this is such a time of year where we really want to be supporting immune function, and we want to promote optimal organ performance and lead to kind of better energy and overall well-being. And it's not a cheat if you only made it a detox, because after detox, to continue that, you have to clean eat that year. So
That's true. And so that is should be part of your resolution, right? To
exactly.
continue on. So, can you break down the different types of detox methodologies that are available today?
Oh, there's so many, right? So,
So many.
um,
Which ones are the real thing? It's always hard because then you say, okay, I want to do a detox. You go onto Amazon. How do you know? And this is probably a whole separate question. Even once you do choose the methodology by which you want to go about this, then how do you choose which one? So I know I'm getting ahead of myself, but I'm good at giving you loaded questions.
yeah, there's many types of detox. Most of what you're going to be hearing from people in general is talking about a liver detox, because that's your master detoxifier in the body. And so we use specific herbs to such as milk thistle or amino acids and antioxidants to kind of enhance those phases of liver detox. You can have a nutritional detox, right? We just come off from loaded sugar holidays, right? And we want to focus on specific foods if we're doing a nutritional detox. So focus on those foods that help support and enhance your liver and kidney and gut function. So those are your anti-inflammatory foods, such as turmeric, ginger, anything omega-3. You want maybe some juice cleanses or even some fasting protocols. So people will do intermittent fasting as part of that. But really the foods that cause inflammation are your highly ultra processed foods. Looking at sugar is something that causes a lot of inflammation. So if you're doing a nutritional detox, it's really about clean eating. And then we get into, I love to talk about the gut microbiome, but a gut detox focusing on removing pathogens, balancing out the microbiome, and promoting kind of gut repair, because all chronic conditions kind of have that gut microbiome component to it. So we want to look at that. And so an example of that could be like probiotic rich diet and helping with the gut detox, and even getting more into looking at testing and things like that. Heavy metal detox, I hear a lot about that. There's a lot of people who have a really high toxic burden of heavy metals depending on where they live in this country, what type of work they do. And so we're looking at removing heavy metals like mercury and lead. And sometimes we use dietary supplements. And then there's even some evidence about chelation therapy, which helps pull out the heavy metals as well. And then you've heard a lot of people talk about like lymph drainage or lymph and skin detox, where we're really getting into the saunas and exercise, sweat therapies, looking at how to basically move our lymph by doing massage or improving that toxic excretion and kind of getting things in the body moving. And then just looking at, a well-focused detox where we're generally optimizing our health and addressing like specific conditions. And then some people will detox medically from substance withdrawal or physical and psychological dependencies that they have. So that's why when you hear detox, it could mean so many things, right?
So many things. And we have Becky that is watching on Facebook, and she is wondering, you mentioned omega-3, and she's curious as to whether or not omega-3s are okay for people with peripheral artery disease or coronary artery disease. And I think what she's referencing is there are a lot of patients are on blood thinners, and it can be contraindicated for people who are on blood thinners because omegas can also thin the blood. And we just went through this with my dad, where his hematologist had taken him off of all of his omegas because he was on both an antiplatelet and anticoagulant, and he's a bleeder. And when he got off the Plavix, he's still on the anticoagulant Eliquis. They said he could go back on, but to watch his arms and watch for any indications of bleeding. She said that normally it'll show up on the arms first. And if you start to get a little easier bruising, then you might want to lay off and do a lesser dose of omega-3s, if at all. But what are your thoughts? Because you have been through this. You're a heart disease patient. You had a heart attack at one point. So I imagine that this is something that you contend with and have been able to figure out for yourself.
Exactly. So when we look at that, it's not a one size fits all. It's very specific to each situation. The studies on omega-3, like when you're supplementing with omega-3, are really kind of hard to look at because you want a higher level, looking at like 3 grams if you're supplementing with that. But what I'm saying and seeing, like, if you're having issues with PAD and you're on blood thinners and everything, it does not hurt to add omega rich foods into your diet. That can be really powerful in reducing inflammation and everything. So doing a food as medicine approach can be really good. So that's looking at, you know, omega 3s in your salmon, chia seeds, flaxseed, you know, looking at fish, different things. The important piece to that is we have a really rich omega-6 diet in the US, right? We use a lot of seed oils and everything. So we want to balance that and have more omega-3s to have an impact on inflammation and on our overall health.
And she's also asking about the metal detox, and she's very interested in learning a little bit more about the types of metal detoxes that are available and what steps she could take to potentially do one.
Okay, with metal detox, I always say work with a practitioner with that for sure. You want to know what you're actually detoxing of those metals. Some of the time, like there's different chelation therapies that can be as simple as a suppository that you're using. Some places use IV infusion for those. So it's what metals do we need to be contending with and what's going on. When we look at other things like maybe even copper, we have to look at what zinc is doing too in the body. So you could, a way to kind of assess your zinc level is looking at your alkaline phosphate that's on your comprehensive metabolic. And if it's below 60, we know that you need more zinc, you need more magnesium. So the heavy metal detoxes, that those ones work with a provider for sure for that.
Okay. Do you think a primary care or something, or do you think that someone needs to go to someone with a functional medicine
I would
certificate?
work with somebody with a functional medicine background and not even just functional medicine, make sure they understand heavy metal detox and they're actually testing for the heavy metals. Before you, though, do any sort of detox for heavy metals or something even stronger like that, we do have to make sure that the gut microbiome is in a line and that we have worked on it some, because you cannot detox something if your gut health isn't optimized. So,
Mhm. And how do individual factors like age and health conditions such as PAD or CAD or autoimmune conditions, or even someone who has potentially had a kidney transplant, and even lifestyle, all of that, there's so many different factors. How do they impact your detox effectiveness? And I guess it would imagine also another factor, which is which detox you're choosing.
well, overall, kind of age as we age, our detox efficiency declines, right? Because we have reduced liver and kidney function. So we know that that declines as we age, and we know that we need the liver and the kidneys functioning optimally to do that. Health
Mhm.
conditions such as chronic illness or liver disease, or gut dysbiosis can impair detox pathways. And when we say chronic illness, that is your PAD, that is your diabetes, cardiovascular disease. And then gut dysbiosis is an imbalance. So if you're somebody who is having to use acid reflux medications, or you're always having bloating, like something is going on in the gut. So a lot of times people think if they have a bowel movement every day, things are okay, but then they have all this other stuff going on like acid reflux, and it's not normal to have acid reflux. So our lifestyle plays a huge part into this with detoxification. So the, ultra processed foods that we have, that poor diet, stress, we have a huge impact of stress in our lives. Lack of sleep and sedentary behaviors can kind of slow down our natural detox process. So you want to be moving. I think we talked before about exercise snacks, where every hour you get up for a minute and do some high knees and get the body moving. That can be helpful in helping detox, because you want to be moving the lymph and get things going. And then One thing that we've talked about a lot is that MTHFR gene, right? That mutation. So variations in that gene can impact your ability to process toxins. So we want to work on methylation with people, making sure that they're also getting like the right type of folate, methylfolate, and then certain medications can really cause a burden on your detox pathway and the liver.
And I know for me, I would love to get your recommendation at some point on a methylated liposomal B vitamin that would be good for the MTHFR. I see you smiling, so I think that you probably have one in mind
Yeah.
because I'm not sure. I think the one that we have works, but it keeps going up by $10 and another $10, and the bottle just shrunk. And so I'm thinking, I don't know about this. There has to be something that's better. And we do like the liposomal. I feel like it's more effective than some of the other ones. There was also, I discovered Metanix, Metanx, I think it is. And
That's who
it's
gave
an
me
over the counter
this. Metanex gave me this cool pen I
Metanix.
showed you.
Okay, so I need you to call them, say thank you so much for that. But how do people get their hands on it at an affordable price? Because it's not covered by most insurance, not covered by Medicare, not covered by TRICARE for Life, and $200 a month. And I guess comparatively to some of the other medications out there, but it may be cheap, but that's still for our budget. It's still very expensive. And we've gone to Amazon, we've gone to quite a few other dealers, and we can't seem to get it at an affordable price. And that was something that was recommended by my dad's podiatrist for neuropathy. And it's interesting because we brought it to the pharmacist that we use, and he said, "Yeah, I'm so sorry. I just want to let you know it's going to be $200 per month." Uh, but he said, "I will tell you, it is totally worth it. It really works." And that's rare for a pharmacist to come out and just be forthcoming to be like, this one really works. So just curious your thoughts.
You're in luck because I know a lot about this product because we prescribe it a lot. But there's actually a specialty pharmacy in the US called Brand Direct in Tampa, Florida. So if you're going to your regular pharmacy and they're giving you a price more than $175 for 3 months, you want to go to Brand Direct. They also have a coupon that takes about $30 to $50 off. So you're getting it for about $60 a month. The first 3 months, you'll get an added thing. Here I'm pitching their product for them, and they didn't even pay me. But so that's a way, send the prescription to Brand Direct in Tampa, Florida. They have a great program where they don't run it through insurance, but you're going to be getting this, medical grade food supplement at a much better discount. One thing I want to say, when they say it works, like it does, and they stand behind their product, in the fact that if after 90 days it did not work for you, it's a money back guarantee. So, like, you're not losing anything for
But
trying.
I don't understand why with something like this that it is not covered by insurance. If it's something that works, why is it not covered by insurance? Such a loaded question. It's almost
Right.
rhetorical because it just doesn't make sense. And the pharmacist would have told me if there was anything wrong with the drug, if it was covered at one point and then they decided not to cover it because there were too many problems reported. I didn't see anything like that. And I even asked him and he said he's never seen it. He doesn't know why. He just knows he can order it, but it's going to be $200. You do need a prescription, but yet it's kind of an over the counter thing. It's very strange. But he said it really does work. So I'm excited to try it. Everyone who's listening, remember the advice and views offered here. Do not take any of them unless you have explicit consent from your own healthcare provider. This is for educational, informational purposes only. This is only just a candid discussion. It's food for thought that you can ultimately have a more productive and satisfying conversation with your own practitioner. But that being said, really interesting. And I just learned something. So, Brand Direct is where I'm going to actually have my dad go since he does have a prescription, he was complaining about neuropathy. He doesn't have any sort of major circulation problem that requires fixing. A lot of it is stemming from his back and possibly maybe, a time with his type 2 diabetes that might have killed, affected some of his nerves. Who knows? But the doctor seems to think this will work. So I'm going to try it.
And on a personal note, so my sister, who Dr. Phillips also kind of saved her limb, she was very young with her first heart
Dr.
attack.
John Phillips in Columbus.
Yeah,
Mhm.
40 when she had her first heart attack, but she had pretty severe vascular stuff by that, and nobody was listening to her for years. So, he helped save her leg, but we added Medinex to her supplement plan. Like she's doing it twice a day, and she will tell you, like she started it before he revascularized her leg, and she told me if she did not take it, she could not walk. So, and so that's when I was really like, wow, because I knew how bad she was feeling and I knew how young she was to be feeling like this. So, I've seen it firsthand with a family member, like be life changing for them. So,
And I want to just clarify it's branddirecthealth.com,
yeah, in
I
Tampa,
believe.
Florida, because there's a couple of them.
Is there? Okay. So I just want to make sure that this is the right one because Brand Direct didn't get me there. But I'm hoping that this one is the right one. I can't quite tell. So I might need you to make sure it doesn't say where it is, but brand, just make sure you get the one out of Tampa is what, and we'll have to Google it and maybe put it in the comment section a little bit later. Unless someone
Okay.
can Google it right now and get us that link, that would be amazing.
I actually
So,
probably I have it right here. You're gonna laugh at me. Don't laugh at me, but I've got it right here. Um,
oh, you do? Good.
yeah.
Yes, what is it?
So Brand Direct Health, and it. What would you rather know? The fax number, the phone number, the
Probably
address?
the phone number and the website would be great.
So
I think
phone
I have
number,
the website. I think is it
it's
866331?
6440. Yep, that's it. You
That's
know
it.
why
So
I
it's
have it here?
branddirecthealth.com.
So I sent it to a wrong pharmacy. So that's how I have this here till it becomes muscle memory. So,
That's perfect. That's great for everyone to know. If anyone's just watching, I think that was a really valuable piece of information to have that discussion, especially if you have neuropathy and you have that personal story with one of your patients to hear the impact that it's had. So if it's just a medical grade vitamin, it might be worth having that discussion with your doctor. Heinz, you have a question. You've been waiting patiently. Go ahead and unmute and ask Nurse
Actually, I
Practitioner.
got three questions. The first one was related
Oh
to
my goodness.
the metal detox. You said the
Yes.
gut health needs to be checked first. How's that checked?
that is through a stool test. That's how I like to do it. I like to look like at the microbiome through a home stool test. Many functional medicine providers, that's how they would tell you to do it as well. So you do a home stool test, you send it, it gets evaluated for good bacteria, bad bacteria, how you're digesting. Do you have an overgrowth? Like looking at H. pylori, looking at zonulin, which is a leaky gut marker. So there's so many valuable things that we can find through looking at the microbiome. I will tell you it's very different from like your Cologuard, which tests the DNA of the stool for a cancer, or your colonoscopy, which is looking for more structural. We're looking at the microbes when anybody's doing a stool test to look at gut health. And let's say you didn't do that, but you're working with a provider. There are some ways to add some healing stuff to the gut just to damper down some symptoms as well.
Okay. I was checked for that a couple of years ago because I had bloody stool. So yeah, and I had pylori. along
Yeah.
with other stuff. Anyway, the second and third question are kind of related to each other. Okay, you're on a detox. Uh, After it's all done, you have to kind of wean yourself back into doing normal eating and drinking? Because you said like last week, no coffee right now. So, you have to be careful what you do when you start back up.
Right. And so, kind of some of the myths is like detox is a one-time event, but we're always continually detoxing in the body. It's a process, right? The part about doing a detox where you're taking some supplements or removing some nutritional things is just to kind of reset the body. And when you've removed foods, and you're doing a nutritional one like that, when you add things back in, so I like to remove foods for about 21 days. And the reason for that is because your IgG response, which is a response that happens when you have a sensitivity to a food, right? In order for that to decrease by half, it takes 21 days. So we at least need 3 weeks on like clean eating to know when we add something back in if it's what's causing the inflammation. And when you add something back in, I like to kind of gradually add things in because you'll add something in, and if you have a new symptom, like let's say you had knee pain, but it went away when you detoxed, and you're like, I wasn't expecting that. I thought it would be something else. But then you added back in dairy and the knee pain returned, you would know you need to leave that out longer, and allow your body more time to heal for that.
Okay. Last question, sort of related to that. How do you know it worked? Besides, okay, you got knee pain and it helped, but do you get another liver check right after you detox, or?
So you can look at liver enzymes. Most people do it on symptoms like, has brain fog improved? How is your energy? How are your stools? So we look at kind of those symptoms that you have. It's always good to kind of go through and write down like your symptoms before you start, and then at the end of it, don't look at that paper, but write your symptoms again, and then kind of compare like what has went away as a result of this, and then you know if things are working or not.
Okay, thanks.
Fantastic. Thank you. Okay, so what are the common misconceptions about detoxification?
Well, one is the one-time thing. It's a continual, but the other is like people think everyone needs detox supplements, and really, in fact, that's not always true, right? Many people can detox efficiently if they have a healthy diet and lifestyle. So sometimes we use the supplements and things for a short term to just kind of boost people, right? Because you need that boost. But it's as impactful as eating completely clean while you're doing it, and doing other things with your lifestyle can be just as impactful. And then one other myth that we hear about is that all toxins can be eliminated through sweating or a colon cleanse, and really different toxins require different pathways for elimination. So it is important to work with somebody if we're working on more than just a kind of food detox or liver detox kind of thing. If you're really getting into other toxins that you're exposed to, there's different pathways. So we want to be specific for you.
Are there any red flags people should watch out for when considering our detox program?
Well, yeah, those extreme claims, right? If somebody promises that an instant detox or complete toxin removal, that's unrealistic, right? The body has a process to doing things. Make sure that there's science behind what they're telling you. There's science behind the supplements that they're telling you. If they can't provide you the science, then I would probably stay away from it. And those harmful
And that's always tough to
practices.
get.
Yeah.
It's always tough to get on like an Amazon, but if you're going direct to website, there was a dietitian that you had on recently with a supplement
Oh,
for
Kara, yeah,
actually restoring the lining in your gut. And on their website, if you go to buy it direct from their website, the supplement that they offer, they have literally a load of actual science, all the studies behind it. So you not only can kind of read their summary of the science, but you can read the studies that were done as
mhm.
well.
And that's what I like. You know, if somebody's telling you products, maybe they don't have all the studies on Amazon, but certain products like what Kara Pendulum's products, that they have a lot of the studies, and that's what I like. I like to follow people who actually give you the science behind it because that substantiates what you're doing
Mhm.
even more. And another thing that we want to red flag kind of thing is those harmful practices. Like beware of detoxes that involve like excessive supplements, starvation, or laxatives. So we want to avoid that. And expensive detox kits, right? High cost products with no evidence. Like those are your red flags. Like you can detox pretty inexpensively.
And the ones especially, and then they have this subscription program, and the products are already expensive themselves, and then they want you to lock into a subscription program, which is frustrating, like one that I had sent to you as well, which I'm still using this one product and it is not working. I don't see any difference. And it's highly expensive. You know what I'm talking about.
Yeah.
It's a nitric oxide thing. But anyway, so how do people then safely approach detoxification without risking their health? And I know that's a loaded question because it depends on where the patient is at in their journey.
Yeah.
But do you have any easy just guidance for people?
Well, just start with the basics,
Just in
right?
general. Yeah.
Balanced whole food diet, right? Getting plenty of water, right, to support kidney function, incorporating regular movement, stress management techniques. Those very basic things that we can do, like we hear it pounded in over and over, you know, eat a healthy diet. So maybe what we need to be like looking into is what a healthy diet really means, like making sure that we're getting enough fiber every day. So for a female, it's 30 to 35 grams. For a male, it's 40 to 45 grams a day. Your protein intake needs to be about 30 to 50 grams of protein per meal. And so those two things right there can really be starting the basics. And it's not, you're not going to get perfection when you first start. So it's just going to be a gradual process to optimize things. But looking at the foods that you eat, like more organic foods, you know, looking at cleaner meats as well. And then get guidance, right? Work with somebody to assess your needs individually and your health risks, and make sure they're using evidence-based therapies and supplements, because you can just Google detox and have a ton of things coming through your email in the next hour, probably after this talk even. So you want to look at the scientific evidence behind what's there, and then just, you know, monitor your symptoms, right? Discontinue anything that causes you to have extreme fatigue, dehydration. If you have dizziness or anything, that should not be happening. Some people will have what we call a Herxheimer reaction the first time that they detox. I will tell you, I had a really hard time doing any supplements for detox for a long time. I had to learn to eat very clean and healthy before I didn't become ill for trying to take something that would detox like in supplement form, because it's so highly concentrated. The first time I tried to detox, I did one of these shakes and I literally vomited 15 minutes later, and I was like, this
Oh,
is
wow.
awful. Yeah. And so at that time, I wasn't the healthiest version of myself. I wasn't working on eating organic, clean, whole foods. And the more you work on that, the easier even adding a few supplements can be.
That's a really good piece of advice. You have to ease into it, right?
Mhm.
Don't just think you're going to change your entire body chemistry overnight with one detox. Don't even try. It's better, as you said, to start gradually easing yourself into it. Start with the healthy diet because you're going to need to be in the habit of a healthy diet once you're done with that detox to continue on with your life. So start there. And one thing I think that you're going to really love, Nurse Practitioner Deidre, is we are focusing a lot on regenerative agriculture, especially going into the next administration, because that is something that if we've heard that RFK has the number of votes needed for confirmation as Health and Human Services Secretary, but and this is not a political discussion. This is just we work with what's in front of us and what we see happening with that next direction or whatever direction it might be, so we can help guide people. And in this direction, it seems like there's a big focus on regenerative agriculture. So last weekend, we talked about regenerative ranching in particular, and how this way of producing meat actually brings it back to the hunter and gatherer days where these meats were more nutrient dense because they were wild and they were living off of fresh land. But now so many of these cattle and other meat sources are literally using more modern practices that lead to nutrient deficient products. And so we talked about that now on January 27th, 6 p.m. Eastern Time. This is the first anyone's hearing about it. We are going to have the chairman of the World Food Bank on, Richard Lackey, and he is going to be talking about regenerative farming and the push towards that. And he has a brand new show that he's going to talk about that is really raising the profile of these regenerative farming practices. And it's a competition where they're teaching the next generation of farmers to take on these practices, leading to more nutrient dense fruits and vegetables. So if you're welcome to
That's
join and be a guest co-host with me, because I think it'll be really fun. It'll be great for everyone who's listening to tune in to that as well with questions. I didn't realize that so much of what we're eating today is not filled with the nutrients that
mhm.
they're supposed to, and that when you go online you say how much vitamin C is in an orange or a lemon or whatever citrus fruit, it's actually not the same as what it should be
Mhm.
because of the current practices and because of the lack of minerals and such in the soils that are used today.
It's just so eye-opening, and this just makes my heart so happy that more people are learning about regenerative farming and learning about these practices because I mean we have the ability to be like so transformational in this country with chronic disease by impacting our food source, making food as medicine.
And so so I hope you can join us. Anyone, everyone, be looking for it. You can go to padhelp.org, and we do have an events calendar there. But even more importantly, again, um, it, Nurse Practitioner Deidre, I'm happy to stream it to your channel as well if you think it'll be helpful for
Yes.
people on yours. Okay, so you can definitely go to youtube.com/at NPDeidre. And when we put up the promotion for the event, you can go ahead and click notify me on the promotion when it is under the live, but subscribe to the channel to get that notification. And you can also be a subscriber for The Way to My Hearts and youtube.com/the way to my heart. Subscribe to that channel and you'll get notified for that as well. But back to our topic du jour, what's the difference between a medical detox and a wellness focus detox, liver detox, and other detoxes that are out there?
Medical
Which ones are
detox,
wellness? Which ones are medical?
medical detox is typically somebody who is withdrawing from substances like drugs or alcohol, and these are supervised by your healthcare professionals to manage the withdrawal symptoms safely. That's typically a medical detox, like when you hear that term being discussed. Your wellness focused detox are really aimed at optimizing your health through dietary and lifestyle changes. This will include those general support for liver, gut, and your immune function. It's the wellness focused ones are looking at clean eating and things like that. So those are the biggest variations there is like when you're looking at medical, it's more substance that we're withdrawing from, and there'll be medications, things like that involved with that for the withdrawal.
And do you have a personal experience or a particular case study of that really illustrates the success of a detox?
I actually do. So we work with people all the time on detoxification and things like that. And so, and I, and I'm hugely in this women's health arena. So when we work with people with fertility, we detox not just the female, but the male, right? And so working to have healthy babies. And so that I've seen that. I've seen this like working with detox where we actually help somebody fertility wise get pregnant and then they have a healthy baby as well. But then I have a lot of people like have like a 45-year-old woman who had kind of chronic fatigue and brain fog and bloating, who kind of reached out and really wanted to do some functional medicine testing and help things. So we do kind of the routine lab panel, look into the gut microbiome and everything. And we kind of plan some detox with them. I usually start with clean eating. I usually start to pull out your sugars, things like that, help to focus on that. And then use some really studied supplements as needed with some milk thistle and acetylcysteine. So NAC is a huge one. And then good quality probiotics, because if the gut is healthy, you're able to kind of help with that detoxification. So your detox pathway in the gut is a marker of that is beta glucuronidase. So we're able to actually look at that and see if you need more fiber, if you need more probiotics. So fiber is important as well. And then we added some lifestyle things, stress reduction. I'm big into binaural beats and having them listen to binaural beats, hydration, walking, forest bathing, things like that. And then in our follow-up, we had increased energy, mental clarity, digestion was better. So that showed an huge impact. But then going a step further down the road, as they cleaned up and we kept working on the clean eating piece after the supplements we used, I was able to change so I calculate out insulin resistance using a calculation called HOMA-IR, which most of the studies show that's how you should assess if somebody's insulin resistant. And anyway, she went from insulin resistant to now we're, 6 months later, and today she's not insulin resistant anymore. And so feeling much better. Things are really great. If we can change insulin resistance, we can change the trajectory of metabolic diseases. So.
But none of this is easy. I mean, when you're talking about your health, you can't change 30, 40, 50, 60, 70 years literally overnight or even in just a few days.
No,
This is something that takes time, and to be able to break all of those habits that you have and all the cravings that you have, it does take time. It does take courage. It
yeah,
takes determination and that perseverance, right?
it
It takes
does.
a powerful mindset. You got to make that commitment.
And it goes back to the discussion we had last week about setting small goals for yourself that are achievable. Give yourself a time frame for each little goal and finding the people in your life that will support you in this, your journey for health. So I have a hiking group on Facebook that encourages me to, like, if I'm feeling like, oh, I don't want to go out in the cold, and then I just see all the people out in the cold, and I'm like, what am I doing? I need to get out there with these people. So yeah, it's making those things what you're ready for today, and then building off from that.
Definitely. And we have Marcia here, and I'm curious if Marcia has a question to share. Marcia, go ahead and unmute.
Excuse me. I wasn't
Hi.
sure if the other Marcia was here, and so I wasn't sure which Marcia you were talking to, but it's always Marcia, Marcia, Marcia.
It's always Marcia, Marcia, Marcia.
Well, I have a question. I'm getting ready to have a surgery done, an amputation, and maybe you could provide for me some general like detox guidelines I might incorporate before my surgery, like, good foods to eat, certain vitamins and minerals I might add to supplement. Just a question like that.
Okay. So to kind of prep for a surgery, I often tell people you want to boost your immune system, right? So your high antioxidant foods. So you should be eating 30 different fruits and vegetables in a week, right? But your high antioxidant foods are the ones that are very dark colored. So you're, purpley colored, you're burgundy. So you want to boost your immune system. This also helps target kind of liver functioning by doing that. And it helps glutathione, which is kind of the powerhouse in all of your cells. Amino acids, which are in your protein sources, right? Because that can help with liver detox. And I find that I can test people for their amino acids, and even people who say they're eating a lot of protein are not always getting the right amino acids. So good, clean quality, and protein helps heal after surgery as well. So you're getting kind of a double for that. And then anti-inflammatory. So reducing sugars and processed foods can be really helpful. Making sure that you're getting the omegas that you need. Turmeric is a great one. An herb, it's well studied. Definitely talk to your doctor about that, because it would depend on medications too that you're on with turmeric, and then ginger. But adding those things to your diet can be really helpful. And then just getting like a good probiotic. We've had Pendulum on here. They have a great metabolic daily one. Seed probiotic is another one I really like. But these can really, like having a good gut microbiome, these can really help you in healing as well. So we're looking not just for detox of like the anesthesia and stuff that you'll have, because your body's going to clear that if you have these high antioxidants, but we're looking at your healing as well. So those amino acids and proteins are really important for that.
Thank you so much. And we did have a question that came in earlier in regards to inflammation and what detox might be appropriate. This patient in particular ended up with all kinds of issues following a pregnancy, became ANA positive, high inflammation. They discovered that this person had a connective tissue disorder, and just she's beside herself right now with no answers. Rheumatology won't give her any answers. I have found rheumatology gives me no answers either. They say, well, after the vax, I'm not going to name any other, else I'm going to get censored again by YouTube, no matter what you say. Even though it's my experience, I ended up having issues. I became ANA positive. I ended up with all these food sensitivities and allergies and all this stuff. And they said, well, you don't fit into any of the categories. Your body's attacking itself, but there's nothing we can do. Good luck to you. Wait, okay. ANA positive, meaning my body's attacking itself, but go home, and just let that run through your brain over and over and over, because there's nothing we can do. Like, no more information. So I don't know, in your experience, if you've had any luck with these folks that are ANA positive that are considered just autoimmune and don't fit into any particular category. With a detox, do you think it
Yeah.
can help to reduce the inflammation in your body caused by all of this?
So I do think it could help, but I think what would help more when you're looking at ANA positive and you're looking at autoimmune, you're looking at like all autoimmune has a gut component. Most of the time it's intestinal permeability, or leaky gut is the buzzword on the street. So looking at how to improve intestinal permeability, because if you have a leaky gut, what happens is food particles, the medications, your stress, all of that creates where the intestinal permeability creates these leaks where things that should never get into your systemic blood system do. And then you start to have nutrient deficiencies. So, magnesium, vitamin D, K, B12. If you have any of those deficiencies, you can also think, she's probably got leaky gut there as well, a positive ANA. But I've been able to turn people's ANA around with working on leaky gut for them and helping out. So a detox is a great start for that, because it is going to improve your gut health, because you're going to be focusing on more clean eating. And the foods that typically become the triggers of this leaky gut and autoimmune, in almost all the literature, is gluten and dairy, which is incredibly hard to remove. So sometimes instead of just removing it, we'll do a food sensitivity and just see if that's the problem. Just because it's a problem in the beginning doesn't mean it's going to be a problem always. But when you're repairing the body, sometimes we have to do hard things and take away stuff we don't want to.
Yep. It makes it tough. And especially, I have this laundry list after the V, that of avocados, mushrooms, all nightshade vegetables, anaphylactic to dairy, gluten intolerant, especially with having the MTHFR mutation, I can't have any enriched foods. And I'm just like, what can I eat? So my dad jokes, and don't take this the wrong way, but he's like, all clear liquids, vodka, water, and oh, by the way, celery. He's like, that's all. He tells people that's all she can have. That's the only thing that she can tolerate, which I think is really hilarious. But yeah, it's very frustrating, for those. But this has been really, really a helpful discussion. Any final thoughts? Anything that we didn't cover in this discussion? Because I know we've come up on an hour here, and I want to respect your time. You have patients to see.
Yeah, I would just say, focus on the clean eating. I'm excited for these couple things you got coming in with regenerative, because I feel like the more knowledge we have, the more we know, the more we can change ourselves. And then find some people to do this with you and walk this journey alongside of you.
Definitely. Thank you so much, everyone, for joining us. Thank you so much, Nurse Practitioner Deidre. And for the trifecta, we'll say it again. Make sure you like this video and subscribe to our channels. Go to youtube.com/at NPDeidre for some amazing content every single week from her. You can also go to our channel for the Global PAD Association. Our 501c3 is The Way to My Heart. So it's youtube.com/at The Way to My Heart. Have a great week.